Every 33 seconds, someone dies from heart disease. But what if the real danger begins silently, years before the pain ever starts? Welcome back to our channel. Today, we're diving into ischemic heart disease, the leading cause of death worldwide. We'll explore what it is, how to catch it early, and the cutting-edge treatments giving hope to millions. Let's protect the heart before it's too late. Ischemic heart disease, IHD, also called coronary artery disease, CAD, is a condition where blood flow to the heart muscle is reduced or blocked, usually due to plaque buildup in the coronary arteries, a process known as atherosclerosis. Without enough oxygen-rich blood, the heart can't function properly. Over time, this can lead to chest pain, angina, heart attacks, heart failure, and even sudden death. It's the #1 cause of death globally, but it's also highly preventable and treatable, especially if caught early. IHD may be silent for years, especially in early stages. But as the arteries narrow, the heart begins to show signs of distress. Common symptoms: chest pain or discomfort, angina, often triggered by physical activity or stress, shortness of breath, fatigue, especially with exertion, pain in the arms, shoulders, neck, jaw, or back, nausea or lightheadedness, especially during a heart attack. Signs in women. Women often present atypically. Indigestion-like symptoms, jaw pain, extreme fatigue, anxiety, or sleep disturbance. Warning signs of heart attack: sudden crushing chest pain, sweating, difficulty breathing, pain radiating down the left arm. If any of these occur, seek emergency help immediately. Ischemic heart disease develops over decades. The following risk factors accelerate artery damage. Non-modifiable risk factors. Age. Risk increases after 45 in men, 55 in women. Family history of heart disease. Gender. Men are at higher risk at earlier ages. Modifiable risk factors. High blood pressure, hypertension, high cholesterol, smoking, diabetes or insulin resistance, obesity, sedentary lifestyle, unhealthy diet, high in trans fats, processed foods, sugar. Chronic stress, depression, and chronic anxiety have strong links with heart disease. Stress causes increased heart rate and blood pressure, damaging arteries over time. Medical therapy for IHD focuses on improving blood flow, preventing clots, reducing workload on the heart, managing cholesterol and blood pressure. Key medications: antiplatelets, examples: aspirin, clopidogrel, prevent clot formation in narrowed arteries. Beta blockers, examples: metoprolol, atenolol, reduce heart rate and blood pressure. Statins, examples: atorvastatin, rosuvastatin, lower LDL cholesterol, and stabilize plaque. Nitrates, examples: nitroglycerin, relieve angina by dilating blood vessels. ACE inhibitors/ARBs, examples: lisinopril, losartan, protect the heart, especially in patients with hypertension or diabetes. Calcium channel blockers, examples: amlodipine, improve blood flow by relaxing arteries. Anticoagulants, for high-risk patients. Examples: warfarin, apixaban. Invasive interventions, if needed: angioplasty and stenting, coronary artery bypass graft, CABG. Surgery. Changing lifestyle is just as important as medication, sometimes even more so. Diet modification. Adopt a Mediterranean diet, rich in olive oil, fruits, vegetables, fish, and whole grains. Reduce sodium, processed foods, saturated fats, and sugar. Increase intake of omega-3 fatty acids, fiber, and plant-based proteins. Physical activity. At least 150 minutes/week of moderate-intensity exercise. Walking, cycling, swimming, or aerobic classes. Exercise improves blood flow, lowers cholesterol and blood pressure. Smoking cessation. One of the most critical changes. Smoking damages arteries and speeds up plaque formation. Stress management. Meditation, yoga, therapy, or even journaling reduces cortisol and adrenaline levels. Sleep hygiene. Poor sleep linked to high blood pressure, obesity, and insulin resistance. Aim for 7 to 8 hours of quality sleep each night. Inflammation and heart disease. Recent studies link chronic low-grade inflammation to atherosclerosis. New drugs like canakinumab target inflammation, not cholesterol, and show promising results in reducing heart attack risk. Genetics and risk prediction. Polygenic risk scores can now help identify genetically at-risk individuals, allowing for earlier interventions. AI-powered diagnostics. Artificial intelligence in ECG and imaging can now predict heart attack risk earlier and more accurately. mRNA technology for cholesterol. mRNA-based treatments like inclisiran lower LDL dramatically, a revolutionary new class in cardiovascular medicine. Gut microbiome and heart health. Emerging research shows that gut bacteria influence inflammation, cholesterol, and heart health. Probiotics and dietary changes may one day complement IHD treatment. Ischemic heart disease may be the world's top killer, but it's also one of the most preventable and manageable diseases when caught early. You can start protecting your heart today. Know the signs. Manage the risks. Don't ignore your chest when it whispers or when it screams. If you found this video informative, please like, share, and subscribe. Let us know in the comments. Have you or someone you love faced heart disease? What changes helped most? Stay informed, stay healthy, and take care of your heart.